Hello friends, welcome to my channel Creating Essence. I am Megan. Thank you so much for stopping by today. I'm out on my back porch enjoying a beautiful spring morning. It's a little chillier and breezier than it has been for a couple of days lately. Sometimes 55 is a nice reprieve from 85. We are technically a little bit overdue, but it's about that time to do another pregnancy update. I am just about done with my 22nd week of pregnancy. I think the last one I did around 16 weeks, but I just figured I would hop on, answer all those questions you all have, and update you on how things are going. I had my regular scheduled checkup with my midwife on Wednesday. It wasn't at the birth center like it usually is. It was via Zoom. The midwives at my birth center are really working hard to keep the birth center a clean and safe place where whole families can come for the birth experience, and then they can thoroughly clean it and keep it clean for the next family to come in and give birth when they need it. So they're kind of doing visits differently, whether they're going to people's homes or they're doing televisits, because they really want to protect and preserve the birth center itself for the birthing families, which I totally respect. Because we are doing appointments this way, things are done a little bit differently. I bought my own blood pressure cuff. I have my own Doppler to keep track of heart tones. I have my own, the little urine testing protein sticks that you use. And at my midwife's request, I'm just tracking those things every week or two and writing them down and keeping in touch with them about that. I am very much a generally healthy person, and I'm totally okay with that approach. Overall, I'm physically doing really well. I still have to stick to that really clean diet of mostly vegetables and a little bit of animal protein when my stomach can handle it. But baby is growing really, really well, and I'm feeling good, and I'm okay with it. There have been a couple of times where I just kind of threw caution to the wind and ate some chips and queso because my family was eating chips and queso and I wanted chips and queso. And let me tell you, I felt pretty rotten pretty immediately afterward, and the whole entire next day my body just felt yucky. So even if I really want to cheat, it's not a pleasant experience despite it tasting good in the short term. So vegetables and fish it is. I have managed to gain 2 pounds in the last month. I'm still very much at a deficit for the whole pregnancy as far as weight gain and loss. I'm really okay with that. I know that, the baby's gonna begin to pack on the pounds. She only weighs 1 pound even right now. But at my ultrasound that I also had on Wednesday, she was perfectly healthy in every way, was a little bit big for her gestational age, which my babies are usually huge for gestational age, so she's perfectly healthy and right on track. So despite my painfully limited diet and my weight loss, she's really healthy, I'm really healthy. I don't care if I gain a single pound the rest of this pregnancy. My belly is starting to get pretty big. I'm starting to really feel the pregnantness because I'm having trouble, stretching and reaching things, and gosh, if I have to put on a shoe that needs tying up, kind of don't get to breathe for the whole time that I'm doing that. My varicose veins and my legs and such are starting to resurface, and they're just not super comfortable. My midwife and I chatted about me taking a horse chestnut supplement at my appointment, and that is something that I'm gonna give a try. She said for some people it doesn't do really much of anything, and for other people it gives enormous amounts of relief. It is completely natural, something found in nature with really no contraindications, so I'm gonna give that a try and see if it helps at all. I posted on my Instagram and Facebook asking if anybody had questions for me to answer in this update today, and there are a few, so I'm going to go ahead and answer them now. One person asked, how is your diastasis? For those of you who don't know, I have had a pretty profound diastasis recti, or diastasis, since my second was born in 2008. That, if you don't know what it is when the connective tissue in the center of your abdominal muscles, called the linea alba, splits. It can get stretched really, really thin during pregnancy, and then it can, tighten back up after you have the baby. But it can also split entirely, causing effectively a tear in that fascia. Usually it starts around the navel, it can stay there, it can go higher or lower. I had higher and lower, and it was pretty severe. But after my sixth was born in 2016, I found a couple of amazing programs. One is Fit to Be, which is a fitness program that's specifically diastasis aware, which means they're not having you do exercises that will make it worse. They're actually having you do exercises in the full picture of full body fitness and wellness that will help you heal. I've also used several courses through the program called the Tummy Team, which is a true licensed physical therapy program. And my diastasis has, over the years, with hard work, after being open for 10 years, completely closed. And it's just been a process of thickening it and strengthening it. So far, it has not opened back up. So far, it's obviously getting stretched, but I can definitely tell a difference in how my belly is held and how much higher, and how I can stand up straighter because my total core is stronger instead of kind of feeling like I'm just falling forward. I have not had any issues with pubic symphysis dysfunction, which is really common kind of co-issue, and one I have always had in the past when I had a diastasis. So I would say it's holding up really well, and I'm really, really grateful for that strength. Another person asked, are you finding everything you need for the baby? So far, I mean, I don't really need much. We breastfeed. I make sure I have my preferred lanolin balm for those early days, and I use reusable nursing pads. I have a pump. I have milk storage bottles and freezer bags. I did get one little pack of our tiny preferred pacifiers for when we do choose to use those, just because I saw them on sale when we were at Walmart one day. We cloth diaper, and I still have all of the diapers pretty much that are still usable from the last 13 years, so we're set there. I've taken advantage of a few clearance deals at places like Carter's and Oshkosh and Old Navy, as well as Target, just to pick up some clothing things here and there. She's pretty well set on newborn through 3 to 6 months, but my babies grow so fast that she'll be through those clothes probably within the first 2 months. I feel confident that anything I need after that, we can get then. I got a new diaper bag on clearance because my old diaper bag I bought in 2007. I figured it was time for an upgrade. And we still have our equipment that we prefer, like a rock and play. Yes, I know about the recall, and we use it safely. I am very aware of positional asphyxiation. My baby wearing devices, we have our crib, a changing table, a dresser. We have all those things still from Solomon when he was born 4 years ago. So really all we still need to get is a car seat. I'm really grateful that it hasn't been a stressful situation as far as finding supplies. Another person asked, do you plan to birth privately or with the kids there? I'm one of those mamas who has to be without my other kids. When my kids outside the womb are present, my brain hyper focuses on making sure they're okay and taking care of them, and it will effectively shut down labor. So when the time comes, either we leave to go to the birth center, or when we've been having a home birth, we've sent them off to a friend's house where we know they'll have a blast. And as soon as the baby's born and, you know, I'm stable and good and the midwives have everything in hand, my husband takes off to go get the kids and bring them home. Another question is, what is the hardest part for you after the baby is born? When I have had breastfeeding difficulties, it has definitely been the hardest part. With my first, it was just a brand new experience. According to all the experts, she had an excellent latch. I just got very sore, I cracked, I bled, and it was really difficult because I didn't know what was normal, what to expect. And there are all those internet things saying, oh, if it hurts, you're doing it wrong. So I was racking my brain like, what am I doing wrong? Turns out, ladies, that is false. Everything can be perfect, and it can still hurt at times because it's just something new that you're getting used to, the baby is learning to do, and there can be definite discomfort and sometimes downright pain because that is very delicate soft tissue that's kind of being manhandled by a baby who's not quite sure what he or she is doing every hour on the hour sometimes. My second had oral muscular issues and never had a good latch, so every feeding was painful until he self-weaned at 12 months. My fourth had what's called a bubble palate. He had a very, very high palate, so his latch took weeks to get right. The other biggest struggle that I've had during the postpartum time has been postpartum depression, and I have gotten it very quickly and very severely, and not just the baby blues, but actual postpartum depression and postpartum anxiety really quickly after babies are born. But with my fourth, for the first time, I tried using my placenta. There are lots of ways to practice using your placenta. I am now a professional placenta encapsulator because that experience with my son 7 years ago that was so transformative in the postpartum recovery made me want to reach out and help other moms that way too. So utilizing my placenta has completely prevented any kind of postpartum depression or postpartum anxiety with any of my last pregnancies since I discovered that with my fourth, and I am so grateful. Another person asks, what are your birth plans? Are you going to have a midwife or a free birth? Right now we're seeing a practice of 3 wonderful midwives. They have a freestanding birth center. They also attend home births. The client gets to choose what they prefer. Right now we are signed up to use the birth center, but we can change our minds at any time. When I realize I'm in labor, I can just let them know, look, I really don't want to leave the house. I think we're staying home. And that's totally fine. They pick up their home birth kit, pack their car with all the necessities for birth, and come to our house. Another question is, how has this quarantine situation affected you during your pregnancy? I said in the video that I did about it, that I'll link in the info box below, back when everything first started, that our lives are kind of quarantined in the first place. Our 7-year-old Aaron is immune compromised and has been since he was about a month old. And we have had to kind of live the way that the powers that be are currently recommending everyone live. That's been our life for 7 years. And I kind of felt like we were in training for this all along. We definitely had an experience this week though that brought it home, and frankly, I lost it. I really just cracked. We had our regularly scheduled ultrasound, the anatomy scan, where they check all baby's parts and pieces and make sure everything's perfectly healthy, which to us is especially important when you're having out of hospital birth, because you want to know, if there's any way possible to know it, that everything is low risk, everything is good, and there's no reason that it would be safer for the baby if I were in hospital. So the morning of the scheduled ultrasound, which was this Wednesday, Josh had taken the morning off from work so he could go with me because he never misses it. It's a really big deal to us. This is the one time we get to peek at that little human that we're growing and kind of get to see their face. It's just a huge bonding experience for us, and we knew we wouldn't be able to bring the kids like we usually do, and we were both really excited to be able to go to the ultrasound and see the baby and see her cute little face. And we were getting ready that morning, and it struck me, wait, maybe Josh can't go with me, because hospitals are so locked down these days. So I called while we were getting dressed, and the woman said, oh, no ma'am, only the patient. No support people are allowed to come with. And I lost it. I lost it. I started bawling. I was hysterical because it was just so upsetting to me that Josh should have to miss that. We haven't left the house in 3 weeks. To me, this was huge. This was really huge. And I pulled it together, got myself sort of appearing as if I hadn't been crying, hugged and kissed the kids goodbye, and went to the appointment. And as soon as I got in the car, I had a full-blown panic attack. I got to my appointment and I filled out my paperwork. And then I was texting Josh, about what's going on. And he said, as soon as you get in there, you can start video messaging me. And then I was handed a paper that I had to sign saying I would not take pictures, I would not record audio, I would not record video, and I would not use my cell phone during my appointment. I had to put my bag and cell phone and everything but my physical body and my clothing, I got to keep those, on a chair by the door. I don't understand what any of that has to do with sound medical care, but it was really upsetting. I was just so upset that my husband was being completely blocked from this entire situation and this entire experience that is really, really important to us. I mean, aside from the birth itself, this appointment is the most important thing for my husband to be a part of. And I know there are so many people that are impacted so much more by this whole situation, but for me, that was huge. And that is it for your questions. That's all I can really think of to update you all on. I thank you all so much for hanging out with me today. I apologize if this breezy weather has impacted my microphone. If you have any other questions, as always, put them in the comments below. I hope you all have a wonderful day, and I will see you again soon.